Hello everyone, it's Michael from Indonesia, currently studying commerce at UNSW Sydney, and here presenting my data story project for Com 5501 Data Visualization and Communication with the topic Navigating the Maze of Healthcare, my personal odyssey from ski slopes to surgical tables. What happens when a music-loving, business-savvy individual encounters two bone fractures, an ACL complete tear, and a tangled web of healthcare complexities? Let's dive into a narrative that elucidates the layers of the Australian healthcare system, exposing gaps and proposing solutions for a healthier, more efficient future. But before that, let me tell you a bit about my story. After achieving ABRSM grade 8 in guitar and piano, I took business studies at Cross University while working, and not long after, got offered to be a shift manager until something unexpected happened. I went skiing with my friends in the snowy mountains where I fell and twisted my left knee. Hence, I resigned from my emerging position and went through an ACL surgery on the 26th of December 2023. I unraveled a series of challenges in the Australian healthcare system which aligned with SDG 3, good health and well-being. First, I experienced medical workforce shortage, hours of waiting time in the hospital, weeks of waiting time for scans and appointments, and months of waiting time for surgery with uncertainty. I encouraged the government to hire, educate, and employ additional healthcare workers, or even outsource from other countries. They may contend that there are differences in qualification, accreditation, and potential cultural gaps. But from the graph shown, we can see countries like South Korea, China, Japan, and Singapore ranked higher in terms of PISA score in science in the last 5 years. US and UK score is justifiably alike as Australia too. Let's also see this graph. We can see how Australia is ranked number 8, the lowest for access to medical care, compared to Norway and United Kingdom, which are ranked 2 and 4 consecutively. Second, regarding global health coverage, government and insurance companies may argue that there are limitations covering surgeries outside Australia due to the complexities of global healthcare system and variations in medical standards. Additionally, they want to keep the insurance affordability and get more profit. Yet, if we see from the graph, insurance companies in countries like Israel and Netherlands are able to cover up to 84%, which reveals there's room for improvement. Third, medical research institutions may aver that the adoption of innovative surgical methods in Australia is a gradual process, considering factors like cost, safety, efficacy, and long-term outcomes. Nonetheless, a region with the highest GDP per capita from 1990 to 2023, with around $60,000 GDP as of 2023, should not make these reasons. If America and Europe with a GDP of around $35,000 can provide exceptionally innovative surgical methods which lead to improved patient outcomes, Australia should be able to spend more on researching better surgical procedures. People may argue that my personal experience may not be representative of the broader healthcare system's functionality and that the identified issues might be isolated incidents rather than systemic problems. But from the graph below, with just 50% of the respondents satisfied with the healthcare system in Australia compared to Saudi Arabia, where 74% were satisfied, there's room for improvement through the three things I've pointed out. Join the movement for a healthcare system that truly prioritizes good health and well-being. Your voice matters in the symphony of change. Thank you.